Hello again. There comes a time when we need to reflect on where we have been, but more importantly, there comes a time when we need to reflect on where we are and where we are going. We all learn from past experiences that allow us to improve on our visions for the future. When we plan ahead, our capacity for self-reflection demands courage and the belief that we can help shape our own environment and our future. We must fight for a life of action, not just a state of reaction. Yes, we all make mistakes. Mistakes are acceptable to a point, depending on the consequences of those mistakes. On the other hand, repetitions of the same mistakes are simply not acceptable. Currently, this appears to be the status of Maine's public health system. A few weeks ago, for reasons known or unknown, Governor LePage and Maine's Department of Health and Human Services Director Mary Mayhew ventured down a road which appears to be a deliberate effort to completely dismantle Maine's public health infrastructure. This new direction is either a personal statement or an outright political ploy. Either way, one has to question why and how these decisions are being made, especially since there does not appear to have been any input from legitimate stakeholders. This public health decimation began with the LePage administration's recent decision to institute a freeze on the hiring of public health nurses. Today, there are less than 25 public health nurses to cover potential crises and threats across the entire state of Maine. This represents a 50% reduction of the number of nurses who were available to use their expertise during the 2009 H1N1 influenza outbreak in Maine. Currently, Maine has more than 20 funded public health nurse slots that Governor LePage is refusing to fill. At least 30% of these positions are funded through maternal and child health block grants and not through the Maine state budget. During this same time, we learned that the Maine Center for Disease Control and Prevention would operate without a director for the remaining months of the LePage administration. Additionally, both the state health officer and chief operations officer of the CDC will report directly to Commissioner Mayhew. So, we are now at a point where our public health system has gone into fragmentation overkill. Now we learn that the LePage administration has decided to, quote, rework, end quote, the way the Department of Health and Human Services and the state will manage substance abuse, tobacco, and chronic disease prevention by ending the services of the state's 27 Healthy Maine partnerships, which have been serving the people of Maine for more than 10 years. Healthy Maine Partners was developed in collaboration by a 40-member public health group that met from 2005 to 2007 and included hospitals, local health care providers, schools, municipal health departments, and other organizations, together forming regional coalitions that performed its work as would a county-level health department. The group's recommendations were incorporated into law by the legislature in 2008. These functions will no longer be coordinated in a regional manner under the governor's new system. Now, the governor's system will rely on 5 organizations that will have statewide responsibility for coordinating a specific public health function. For example, one for substance use prevention, one for tobacco use and exposure, one for obesity prevention, one for youth engagement and empowerment, and one for health communications. In effect, the administration will be outsourcing and privatizing public health services. To make matters even worse, none of the governor's proposals or changes were coordinated with anyone in the public arena or even in the state legislature. This new system seems to be the product of an edict by the governor. 3 of these contracts have already been chosen by the CDC through a competitive bidding process. The 4th contractor was chosen without a competitive bid, and the state is still soliciting proposals for the 5th public health function. Our public health system is the primary barrier in the prevention of the onset and spread of disease. It is a system that is representative of the people and our communities, and as such, needs to be more responsive to the people and their needs. Public health services should be considered a part of our state's social safety net. Maine is an aging rural state of 1.3 million people, covering 30,862 square miles. One can only imagine which services will be curtailed or eliminated by the next edict of Governor LePage and the Department of Health and Human Services. What will become of the visiting nurse program that is so vital for our homebound senior citizens? Lest anyone should forget, Maine is in the midst of a deadly opioid epidemic that is severely disrupting and destroying the lives of so many of our young people. The current administration is composed of the same people who are supposed to be looking out for the health and welfare of all Maine citizens. Their actions thus far do not bode well for any trust or sense of security that our state will be able to handle this very serious and devastating crisis. As Franklin Delano Roosevelt noted, the success or failure of any government in the final analysis must be measured by the well-being of its citizens. Nothing can be more important to a state than its public health. The state's paramount concern should be the health of its people. This is not the way life should be. Our governmental agencies have both a legal and a moral responsibility to protect the health of the public. In this endeavor, we are seriously failing the citizens of Maine. Governor LePage and the Department of Health and Human Services seem to have left out the most important component in its name: human. That is a sad and disturbing dynamic which cannot and should not be accepted or tolerated. Maine is not fulfilling its promise to its citizens. Until next time, I thank you for watching.